Good morning to all of you joining us here in the room. Warm welcome. Also warm welcome to everybody joining us online. I'm very pleased to host this panel today on deepening collaboration with the Global South for health futures. My name is Lisa Görlitz. I'm the head of the Brussels office of the Global Health NGO DSW. Our work focuses on neglected areas of health. We work on sexual and reproductive health and rights and on research and innovation for neglected diseases, but also for research and innovation on specific women's health needs. A healthy and sustainable world requires investing in global health innovations, not only to fight current and future pandemics, but also to address unmet medical need and market failures. As cases in point, poverty-related and neglected diseases or unique health needs for women require a coordinated approach and wider cooperation with the Global South. At this critical juncture of the EU's Research Framework Programme, we wanted to take an opportunity to look at how R&I cooperation and FP10 can be designed to give the best future prospects for the citizens in Europe, but also around the globe. How has EU-funded research delivered on shared global health challenges? We are joined today by a distinguished and very diverse panel. Thank you very much for joining us to discuss how the EU's research and innovation activities and the next Research and Innovation Framework Programme, FP10, can systematically integrate a gender lens and a global approach to health research and deliver on the ambitions of the EU Global Health Strategy. Our panelists' full biographies are available in the event program and online, so in the interest of time, I will not read them out for you now, but I will give a short introduction when I first address them. We will have 2 rounds of panel discussion. We are a bit late, but we will come to you, the audience, at half time. So do think of any questions while you're listening, and for those of you following online, please drop your questions in the Q&A box. I have a colleague monitoring the Q&A box. Andrew, let me come to you first. Chief Strategy Officer at Policy Cures Research, your organization's expertise lies in mapping and understanding the landscape of global health R&D investments, with a mission to advance medical research and biomedical innovation for historically neglected and underfunded health issues. Could you set the scene for us with an overview of funding trends for areas of unmet medical needs in the past years?
Yeah, thanks very much, Lisa. Hi, everyone. Pleasure to be here today. I'll just say that we report on investment specifically in product-related biomedical R&D, and that's no reflection on the relative importance of other areas of research and development. We know that tools don't deliver themselves, but in terms of the research that we do, we're looking at the investment landscape for the development of new drugs, vaccines, biologics, diagnostic products, vector control products, across a number of global health areas. And I'll explain a little bit the different areas, disease areas or health condition areas that we look at, because the market drivers and therefore the funding dynamics for each of those vary, and the nuance is quite important, I think. So in the first instance, we look at poverty-related neglected diseases. This would encompass things like HIV, TB, malaria, many of the WHO recognized neglected tropical diseases. We also look at investment in new products for emerging infectious diseases, diseases of pandemic potential. We know, of course, that COVID had no lack of market drivers, but there were a lot of grave failures in terms of equitable distribution and access to products. And finally, we also look at sexual and reproductive health. At the moment, that includes a combination of health areas like contraception, STIs, HPV and HPV-related cervical cancer, and a variety of gynecological and obstetric conditions. So, preamble done. I'll try to explain a little bit what the last 10 years of funding look like across those 3 global health areas. If we take a look first at poverty-related neglected diseases, we're talking about an average annual investment of about $4 billion US. And if I tried to describe that trend line over a 10-year period, you wouldn't see a lot of exciting activity on that trend line. There's no great variation up or down. It did trend gradually upwards until about 2018. In the couple of years that followed, you see a gradual decline. You see a plateauing of that funding during the COVID years in 2020 and 2021. And for 2022, which is the latest data we have available, we've just published this, you actually see a really worrying downward trend, a pretty stark trend downward of a 10% drop in funding, which is really driven by inflation and the realities of purchasing power globally. So if you looked at the absolute values, they wouldn't change very much, but we adjust for inflation because it's important to understand what you can actually do with the money that you're given. EID-related funding prior to COVID, this was at about a quarter of that level, about $1 billion annually, a lot to Ebola and Zika funding. During COVID, this spikes dramatically, $7 billion a year annually. Most of that's going to COVID, and even that's a pretty vast underestimation. Sexual and reproductive health is a much more neglected area. We're looking at values at about half $500 million annually in sexual and reproductive health investment, and maybe I'll have an opportunity a little bit later to dive into why I think that's the case. Public funding plays a very important role here. The US plays a very important role, but industry and philanthropic organizations are really key players in this space as well. I'll pause there. I think I don't want to take too much time from the other speakers, but if there are other questions about some of the dynamics or the nuances of that funding landscape, I'm happy to answer those.
Thank you very much, Andrew. And I can really recommend checking out the GFINA reports and the data portal, also for looking at it in a more visual way than in a panel. It's always exciting what kind of stories this data can tell us. The European Commission is actually the second largest public funder of neglected infectious disease R&D, according to the GFINA report from Polysecure's research, and much of this funding is channeled via the EDCTP. I now turn to Ms. Russo, Director for Global Approach and International Partnership at DG RTD. You were actually involved in setting up the EDCTP, and now you sit on the board of its current iteration, the Global Health EDCTP 3 joint undertaking, because we love complicated names in the EU. Tell us, in your view, what makes EDCTP so special or unique? What distinguishes this partnership from other initiatives? And how could other EU and member state initiatives in the area of global health learn from EDCTP, for example, in terms of equal partnership, inclusion of vulnerable populations, and research and innovation priority setting?
Thank you very much, and good morning to everybody. Indeed, it was a long time ago. It was in 2004 when we set up the EDCTP, and indeed I had the chance to be there. I was not the only one. I see somebody else in the room, my former Director General Robert Jan Smits, who was there too. And of course, that was really an important endeavor to set up the EDCTP, because it was the first ever partnership that we have set up in the field of research and innovation, based on what was called in the previous treaty Article 169, now Article 185, which in fact allows the European Commission to join up joint initiatives of EU member states. The question there was that we wanted to tackle the poverty-related diseases in Africa, malaria, HIV, and tuberculosis, which were amongst, provoked around 80% of the morbidity and mortality in sub-Saharan Africa. For that, there was not a lot of research conducted. It was very expensive, and there was the need to develop clinical trials, and that were expensive, so it was necessary to put funds there. But it was not only the fact of developing the clinical trials, but also involve the African policy makers in the planning and the implementation of clinical trials. And that's why we thought that it was important not only to mobilize funds from the EU, from the member states, but also to have the African countries fully involved in these endeavors. And that's where, already in 2004, so 20 years ago, we made a shift from this traditional developing cooperation, where we would get to give the funds to the recipient countries, to something which is co-ownership and co-design in terms of policy, which, by the way, it is really embedded now in the EU strategy with regards to Africa, And I would like to mention the latest communication of the European Commission and External Action Service of 2019, which, by the way, will be now revamped with a new communication in April this year. So we have started this program, the EDCTP, based on equal partnership and involvement of the EU member states, African countries, and the European Commission. And I'm very happy to see here Phil Mijwara, who is the Director General of the Department of Science and Technology in South Africa, also acknowledging the important, huge role that South Africa had in the development of the EDCTP. And by the way, the African office of the ECTP is in South Africa. Now, the beginning was difficult. I mean, it was difficult in terms of structure, in terms of how make it operational. But at the end, we finished the first EDCTP with 245 projects, out of which 70% had an African coordinator, which already shows in terms of results really the involvement of the African research community. And there were more than 500 African professionals which were trained. Now we have expanded the EDCTP 2 and 3. We are currently under the EDCTP 3, the Global Health Joint Undertaking, which has a duration from 2022 to 2031, and it has a total budget of 1.6 billion euros. Now, the lessons that we can take from the EDCTP. As I said, it was a precursor of those partnerships in research and innovation, which now are very wide throughout the EU research and innovation programs. Let me, for example, mention PRIMA, the Partnership for Reinforced Cooperation in the Mediterranean, which we are now about to prolong for 3 years more. And there are many others in the interest of time. I'll not mention all of them, but there are 3 main points that I think should be highlighted here. First of all, that it is important that the member states work together. I mean, now it goes almost without saying, also with the development of the European research area and its agenda, but that was not, c'était pas donné. So it's really important that we join up efforts, EU and the member states. Then the second element is that we should continue, pursue, and promote this shift from cooperation for development to an equal footing for all partners, European and African. This is really key, equal footing and co-ownership. And last but not least, in order to succeed in these initiatives, you need really long-term commitment and full political support.
I'm very glad you mentioned that, and I think this is indeed what we are sometimes lacking, and EDCTP has undoubtedly contributed to advancing some of the candidates through the clinical pipeline. We have a much richer pipeline now of candidates against neglected diseases. So I think, these 3 points we should keep in mind for the rest of the discussion. And it's also no coincidence that we have the president of the South African Medical Research Council here, Professor Glenda Gray. Thank you so much for joining us. You actually mark 10 years as a president of the Research Council, so congratulations. I'd like to pick up on the topic of inclusion in research. You've been recognized for your contribution to advancing the careers of women scientists, which we know is crucial if we want to consider the gender dimension in research and also take into account the unique health needs of women in medical research. From your experience, what's needed to drive forward a more gender-equal research agenda?
Well, thanks for that. At the South African Medical Research Council, we employed both formal and informal ways of addressing issues of transformation. So when we talk about balancing science in South Africa, we look at both the role of gender and race and locale with the geography, where you're rural or urban. And so we see transformation at the MRC as active, that basically you have to have baseline indicators, baseline characteristics, and then indicators where you can track your progress. So it's a very active process. We don't allow it to be passive. And so we've been able to, over the last decade, really address the issues of gender, race, and which institution you come from historically disadvantaged versus privileged universities, as well as rural and urban institutions. And as I said before, it's been data-driven and with our indicators, so we can track our progress. First of all, we have to acknowledge the structural barriers that prevent the advancements of women from the early stages of their careers into science leaders, and we focused on that. And what we've found in our research is that women do peak later than men, for lots of reasons, for reproductive, family, and that. And women, peak between 5 and 10 years later than men. And so when we look at our grants, we have to take that into account. And so looking at our data, we've streamlined our approaches. So for early stage investigator, we've set the age for women to 40, whereas for men it's 35. We've also done calls that only women can apply for, or only black scientists can apply for, to try and recorrect the imbalances of the past. And so creating special calls or making sure that we address the issue of where you come from helps us increase the amount of black scientists that are getting grants from the MRC as well as women. And over the last 10 years, we've moved from 20% of awards going to black Africans to almost now 70% going to black scientists. So we have tangible results on that. So we also have to try and address the issue of, so a lot of women become technical experts or choose the technical route rather than the science route. And we've tried to address that by creating opportunities for mid-career scientists to give women mid-career awards that'll take them from a mid-career to a science leader. And that's been very successful, and we've been able to do this. This is a very good grant, and it really allows you to leapfrog into becoming a science leader. So that really has helped us in terms of addressing the issue. Formal mentoring is important, but there's a lot of informal stuff. It's the qualitative stuff that really advance women. And so what we've tried to address is the creative opportunities for women. So we've watched how men work in science and tried to emulate that. So we've tried to make sure that we create opportunities for women by engaging in informal relationships with women, both inside and outside the workplace, to support networking. Men are very good at networking, and men network at the bar and golf, and women, are usually at home cooking. So trying to find a way of helping women network in ways that allow them to grow. And then also in terms of creating opportunities, making sure that you're nominating women to be part of science boards, academies, nominating them and supporting them on grant applications, as well as various prizes that enhance the caliber of women. It's also important to pass on advice. A lot of men pass on advice to the young men in their career, and so to try and engage the fact that women should be passing on advice to younger women, as well as nurturing the shared interest to improve women's excitement about being involved in science. And so we also have to find, women are often excluded in areas where advancement happens, and to try and create opportunities for women not to be excluded in these areas, to make sure that we look at leadership and try and find a new way of developing women so that they become the leader that we should all aspire to.
Thank you very much for these inspiring words. 2 points I take away from your intervention: definitely the need for a proactive approach, not to remain passive, and also the importance of data. And it's very true, we cannot, looking at biomedical research, for example, in vitro studies, I think only in 5% of cases the sex of the cells is even reported. So we do not know if innovations we are developing are actually working for both sexes. So data, and also advancing the careers of women scientists who will maybe put more emphasis on these kind of issues is very important. Supporting equal partnership in research, coming back to the theme of EDCTP, or research that delivers on equality and sustainable development, has historically been rather the exception than the norm. But at the French Research Institute for Sustainable Development, or IRD, investment in building equitable research partnerships with low and middle income countries are not so new, let's say. And Dr. Benjamin Roche, Chief Scientific Officer for One Health at the IRD, could you tell us a bit about this scientific model to promote inter- and interdisciplinary collaborative science? And what I'd be also very interested in knowing is whether this approach is driven by or at least aligned with political priorities for research and innovation in France.
So thank you so much for the invitation for this fantastic panel with such
I
distinguished
think
speakers.
the microphone is it?
Is it working now?
Yes.
Yeah, okay, good. So I was saying thank you for the invitation. Yeah, no, definitely at IRD, so we try to develop so this kind of and interdisciplinarity approach since a while. So IRD is celebrating this year, so it's 80th birthday, so it's quite an institute with a long history. And so what we try also to develop and to support with IRD is really this kind of interdisciplinarity approach, but to be much more than just some kind of broad terms. We really try to put concrete things behind that. And so in order to be more concrete, so what we try to develop, especially in relationship with health issues, is really an integrative approach like the One Health approach, and really with the Global South, and to try to really root it in sustainability science, because we know that all the different crises are connected. So we had a very good illustration with pandemic, but we knew that emerging infectious diseases were actually increasing in terms of frequency since decades. So we knew that at some point we will have something which has to be linked also, of course, with human connectivity, but also with biodiversity loss, with climate change, and so on and so forth. So we really try to develop this kind of interdisciplinarity and inter-actors also kind of research. So just to speak very quickly about two concrete examples that we did this last year. So the first one is about Ebola outbreak in Western Africa. So what we try to do is really to develop this kind of international research approach. So we try to contribute to the effort to respond to this kind of huge health crisis, but at the same time to try to better understand and better knowing actually who is our enemy, who we have to fight against, and how we can be better prepared after for the next crisis. So this is really a transdisciplinary kind of investigation approach, but really to also try to produce new knowledge about this kind of emerging infectious disease. And so one key point, so of course we have developed capacity building for local researchers, but also platform, and especially genomic platforms. So a couple of years later, when a new outbreak of Ebola arises in the same countries, the diagnostic, so the confirmation of Ebola diagnostic has decreased from several weeks to several days. And so when we have to respond to some crisis like that, time does matter. So that's really, I think, a concrete example on how research, actors' engagement, and so on and so forth can really be connected to really have a great impact and a real change actually on the ground. Another kind of example, so you were talking about alignment with French policies, is about more kind of prevention approach. So France launched 2.5 years ago by President Macron, so the PREZOD initiative, which stands for Preventing Zoonotic Disease Emergence, which has the huge objective of trying to develop, to co-design with all the different actors, prevention strategy based on ecosystem management, based on One Health surveillance system through the world, in order not to just respond, not just to get prepared, but also to prevent this kind of emerging crisis. So it has been launched by France with a clear mandate to be as international as possible. So IRD is a proud co-founder of PREZOD, and now PREZOD involves more than 230 institutions through the world, as well as 25 governments. So the idea is also to connect with the quadripartite, with a lot of different actors to co-design, co-develop, and co-implement actually this kind of research strategies, especially with low and middle income countries. So that's really, I think, the key point we're trying to develop is so this kind of co-design approach that we have to connect actually so the answers the researchers are developing with the questions that are really existing on the ground. So in order also to improve so the acceptability and so the efficiency of this kind of strategies on the ground. Over to you. Thanks.
Thank you. That sounds amazing, actually. So as international as possible.
Yeah.
That I take away from your speech, and also, yeah, I think it's a good point you made on being faster and responding, and it's something that tends to be forgotten sometimes. How actually decades of investments in neglected disease R&D, including in sub-Saharan Africa, has helped so much in speeding up the response to the COVID-19 crisis, and without established networks, but also actually platforms that were developed, we wouldn't have been able to develop vaccines at the speed we did, or respond at the speed we did. Turning to somebody with extensive experience in the field, Peter Piot, you don't need any introduction, I think, from contributing to discovering Ebola to being the founding director of UNAIDS, to your role today advising President von der Leyen on European and global health security. What, in your view, have been the biggest improvements that you've seen in advancing the research agenda in this field of global health? And what do you see as the biggest barriers standing in the way of progress? And if you have any recommendations of how to overcome these, then...
Thanks, Lisa, and all in 2 minutes. So, no, but I'm really, it's great that this event also has a session on the global dimension. It's so important. Let me also start with Ebola, because in 1976, so nearly 50 years ago, I was part of the team that isolated Ebola virus. It was at the Institute of Tropical Medicine in Antwerp. And yet, this was a sample coming from what was then called Zaire, Democratic Republic of Congo. And the reason we did that was that at that time, in this huge country, there was not one single virological laboratory that was able to isolate the virus. I'm not even talking about BSL-4 or so context, because we didn't have that either, because we had no clue that this was Ebola. And compare that to recent outbreaks in DRC, where, at INRB, the Institut National de Recherche Biomédicale, led by Professor Jean-Jacques Muyembe, they do sequencing, they do the diagnosis, as you said. They also developed some monoclonal antibodies, and then together with US NIH, that's now becoming commercialized. That's an indicator that we've come from very far, some countries, and that today there is so much more possible. And in public health and research, we tend to focus on everything that goes wrong, but let's not forget that there's been enormous progress when you look at, even go back to 2000, and the Sustainable Development Goals. I mean, there's been enormous progress in under 5 mortality, HIV treatment, and survival, neglected infectious diseases, even some women's health, a lot of still unsolved problems. And that's a combination, I think, of progress in science and research, but particularly, socioeconomic development, and then some global initiatives from the Global Fund, from Gavi, PEPFAR also when it comes to HIV. And I think that's an illustration that you can't see science in isolation. I once said, because of my experience in AIDS, science without the politics is nice, but will have zero impact for people. And politics that goes against science, that can be very dangerous. We've had recent examples in COVID also. But so there's real progress, but I think there's also major progress in the how. One, there are now centers of excellence in terms of research and science all over the world. Asia led the way in a sense, but in Latin America, in Africa, we have Glenda here with us, so you can give a talk on that also. And you don't need to do it, but it's all over Africa. And then also we have the networks, and I think EDCTP has definitely played a role in that, but also, and I'm a bit biased because of my HIV past, but when you look at the networks of HIV prevention and treatment network, I mean, they have really led to a strong capacity that can be used for other things. And when COVID came up, you can use that for clinical trials. There's also, I think, is also progress. The collaboration is no longer just north-south in one direction, but it's also a lot of south-south. When you look at a country like Brazil, I was in India last week, in Bangalore and Hyderabad. These are two absolute, I would say, world-class centers in many aspects, you know, from IT to, you know, to biotech and so on. But so that it's becoming a far more global kind of enterprise than ever before, and I think that's going to benefit everybody. And finally, you know, since this is also about business, there are startups. I was in October, I think. Yeah, I was in Dakar for the Grand Challenges meeting organized by the Gates Foundation. You know, it was what gave me the most joy was the number of young entrepreneurs who were there, a lot of women, and a lot was driven by AI. They jumped on it, but in many aspects, and I think that's new. And sometimes I think there's more dynamism there than what I see here. In terms of the barriers, okay, we can give a whole lecture of it, but I think let me first bust a myth, and then that there is a problem of capacity. And we should ban the word capacity building for good in our work, because there is capacity. And, you know, the number of people at all levels and all degrees, masters, the PhDs and everything you need to do research, people are there. But it's sometimes the institutions, it's the salaries, it's the incentives, that's what the problem is. And so I think so capacity is not the problem. What is the problem is money. We have to be clear about that. And money is power. And that's a big difference that I see between Asia, you know, and Africa, because many Asian countries have now huge research budgets that actually exceed the research budgets in GDP percentage of many EU member states. And so I've been involved in a number of partnerships and where they say, we don't need your money. What we want to do is work together and, you know, define what the priorities are and then do it. And I think that's something that we have to think through, because if you control the funding, I mean, it automatically gives you more power. But on the other, and you can't expect also complete altruism to say, no, we don't want anything to do, here's the money. So how to find that a compromise, and we can come back to that later on. Because that gives me the third point, and that is that there is a slow shift in who sets the agenda, because that is really also important. And we come back to that later on, want to say, and in terms of governance. And finally, I would say that when you look at the EU Global Health Strategy, which was just, I don't know what the official term is, I'm very bad in bureaucracy.
Adopted.
It's adopted. Okay,
and now
fine.
also endorsed by the council.
Yes, okay, fine.
Last week.
But that is a very different spirit. The way it's presented, both in terms of the fact that partnerships, but also far more multi-sectoral, multidisciplinary. So there is hope to go to, but these things will not happen spontaneously. We have to work and sometimes fight for it. Thank you.
And also thank you for bringing a positive perspective and acknowledging the progress that has been made. I would, even though we are running a bit late, love to take a few questions from the audience, and maybe also, there don't seem to be any in the Q&A box, but if somebody is following online, you can still post in the Q&A box. Are there any questions in the room? Let's see, gentleman over there.
Good morning, Simon Pickard from Science Business. I think one of the notable accomplishments around COVID in EU-Africa cooperation was the COVID-19 data platform and the attempts to link that also with the African Open Science platform. But beyond a pandemic and a global crisis, I wonder to what degree data sharing, data exchange systems, platforms and policies are really supporting the collaboration in science and medicine and health between Africa and Europe.
Okay. Is there any other question? And we can lump them together. If not, Glenda, I see you have...
Yeah. So we were very good in South Africa of developing data sharing, data platform processes spurred on by the Department of Science and Innovation and the CSIR. And so, which allowed us to merge excess deaths with hospital admissions, as well as the National Health Laboratory COVID testing. So we could quickly get a feel of the burden of disease, in addition to our genomic surveillance that helped identify Omicron and Beta, which we shared with the African Union, and we also shared all our genomic analysis at a global level with GISAID. So very quickly, South Africa rapidly shared its data to help the world. And in fact, the publishing of our Omicron data helped people like Moderna and Pfizer develop their next generation vaccine. So I think we've set a global, a continent standard about the willingness to share data during pandemics, which in science, we believe in open data and open access. We subscribe to the co-read principles of open access publishing. And so I think it's an important initiative for Africa to share data. But it's kind of not bi-directional. So, we share a lot of data, and sometimes the benefit sharing back to our continent, needs to be, to be developed further. And often our data sharing means that the global north are publishing with us as middle authors, where sometimes we're the originators of the data. So it's a complex relationship. But I think we've definitely in South Africa are committed to open data and data sharing.
May I add something on that? I think it's important to say that open data and data sharing, it's one of the key features of the EU research and innovation policy and related instruments, the framework program, of course. And also, I will speak later about the global approach to research and innovation, which is the international cooperation strategy for research and innovation, which is based also on values and principles for international cooperation in research and innovation, amongst which we have indeed open data and data sharing.
Yes, indeed. And I think it's a perfect example also of why we need to shift away from altruism or maybe using the word capacity building, because we need to recognize the innovation potential also of this African continent and what we can learn from each other. I see there's one more question.
Thank you. So my name is Dan André. I represent the University Alliance Stockholm Trio in Brussels now. A bit follow-up about the Commission global approach, and also what you said, Peter, about the spirit in Africa now with entrepreneurs and more money going into research and innovation. I have some experience working with India and frugal innovation, and where a Swedish company has been very interested to cooperate with entrepreneurs in India, for example. I was thinking of, Africa is also a very interesting market in the future, and if the framework program could contribute to this, to encourage cooperation between European companies and researchers and entrepreneurs in Africa. And this could be a kind of win-win situation, both for Europe and Africa. And that could be maybe a new activity in the next framework program.
I love this suggestion. There is actually the Africa Initiative within the Horizon Europe. But yeah, unfortunately, there wasn't any health-related Africa Initiative. There wasn't no health.
Yes,
it should be a priority.
Of course. There are indeed two African initiatives in the Horizon Europe two last work programs, and health features very prominently in the first Africa initiative, because in fact this is one of the key priorities which have been decided at the at the EU-African Union Research and Innovation meeting, which was the first one ever in June 2020, with specific agenda including public health, which is translated into concrete actions within the African initiative in the Horizon Europe program. Yeah.
That's why we very much hope to see more calls for proposals as part of the health cluster work programs also for Horizon Europe in this area. We have 15 minutes, maybe 20, 15 minutes left. So there are still a couple of things I'd love to talk about with our speakers, but we'll have to ask you to be very brief. Andrew, let me turn back to you. Funding is undoubtedly one of the biggest barriers, as we also heard from Peter, to advancing research in areas of unmet medical needs, such as women's health. From your latest report on sexual and reproductive health R&D funding, what we see is going of prioritization towards technologies for use in high-income countries. And one could say at the detriment of investments in challenges that continue to cost lives in the global south. In tackling shared challenges, what can be done to ensure that research produces evidence and products and innovation that can deliver benefits for both the global north and the global south? What do you think?
Thanks, Lisa. It's a really important question, and I guess I'd like to acknowledge that we often conflate sexual and reproductive health with women's health. And it's a proxy, but it's an imperfect one, because women's health encompasses so many things, so many disease areas, conditions, life stages that are not reflected well in the scope of conditions and diseases that we talk about in global health, frankly. But that aside, when we look at sexual and reproductive health, we are in many cases talking about conditions that impact women either exclusively or disproportionately, and this is why it becomes a proxy. But I'll paint just one picture which I think helps illustrate the intersectionalities of neglect that are faced in women's health R&D. If you look at the couple of obstetric conditions for which we track investment, postpartum hemorrhage and preeclampsia, the European investment, bilateral and from the European Union, in sexual and reproductive health, less than 1% of all of that funding is going towards these maternal health product-related R&D efforts. And there's a reason for that, because you have not only are you trying to pursue research for women, you're trying to pursue research for women in low and middle income country settings, and then you're trying to pursue research for pregnant women in low and middle income country settings. All of these things are resulting in confounding and conflating market failures. And there have been for some time now, the investment case is clear, the science and policy frameworks are in place saying we must be more balanced and respectful of gender equity in our pursuit of clinical research. But a lot of these policy frameworks just don't, or the incentives that exist don't have enough teeth to them, frankly. You look at the Pediatric Improvement Plan that the EU passed in 2007, and following that, this was policy implemented because of a real dearth in known safe medicines for use in children. And after that, you see a real rise in the number of clinical trials that include children, the number of indications and medicines that come to market. And some would posit that you need this kind of teeth, essentially, to compel industry to come to the table. And you need better incentives, I think, because we have to face the reality that there are, and these are industry's words, there are reputational risks that they're not prepared to take on in pursuing research in women and pursuing research in pregnant women in particular. So I think we have to think about carrots and sticks. We have to think about the incentive frameworks to not only draw but compel, perhaps, players to make advanced progress in this space.
Okay, yeah, thank you very much. That's a beautiful example where a carrot policy, let's say, led to success that you can actually see in the data you're tracking. So maybe I can come back to Ms. Russo, because undoubtedly we have seen a deepening of the collaboration with the Global South and Africa through all the initiatives you mentioned during Horizon Europe. And given the persisting funding needs, do you think we can expect this development evolving also in the next Research and Innovation Framework Program? Can we expect greater alignment between the Commission's development and research agendas in the future?
Yes, thank you very much. That's a very good question. Indeed, I mean, the funding restrictions will most probably exist. It's difficult at this stage to speak about funding for the next Research Innovation Framework Program, although we do hope that the funding level will be as high as possible. But certainly it's a question of the impact of the funds. So, I mean, I think that what was said so far, with the work that we have done with the Global South, with a clear also strategy within the context of the global approach, with some key initiatives like, for example, the African Union, European Union Innovation Agenda. Peter, you spoke about startups. I mean, the energy that is there in the South. And we have tried to really capture together with our African partners this energy in order to set up together. I insist in together, it's my leitmotif, really, this innovation agenda, which really aims at translating into tangible results, products, the result of research. And all that has proven to be effective. So what I would like to say is that we do not know yet which would be the amount of money that will be allocated for the next framework program. We hope that it will be as high as possible and necessary. But I do believe that we have shown that with the initiatives that we have carried out with the Global South, we have really demonstrated the effectiveness of what we do. So I'm very confident that what has been built will be further developed in the next framework program. I'm an optimist by nature, but I often get it right, so I hope it will happen.
I would agree with your optimism here, and ultimately, I mean, it's the funding that will go to the next research framework program is an investment with a huge return on investment for European citizens, European economy. So I join you in being optimistic for bigger and more ambitious budget for FP10. But we will need to prioritize, of course. And Peter, maybe I can come back to you. At times of growing global challenges and competing priorities, let's say, from climate change to antimicrobial resistance, how can funders best ensure a balance of prioritization between, let's say, persisting challenges that tend to be neglected, like women's health issues, sexual and reproductive health as a proxy, but also new challenges like emerging infectious diseases, for example?
First of all, I would say that the agenda for global health should not be set in Brussels. As a minimum, it should be a co-creation. And I think we all agree that was the spirit, but still the case. So we need to invest in mechanisms, and I'm a strong believer in regional approaches. One of the silver linings of this COVID epidemic has been the emergence of the African Union. And at the time, then President Ramaphosa was the president of it, and afterwards others, as a real player, and not waiting for, let's say, charity from here also. And I think that setting that agenda, I think we need to go back to square one sometimes and see what are the priorities for the regions concerned. And I'm not only thinking of Africa. I mean, there's also there's ASEAN, there is there's in the middle, there's the Middle East, there's India, Latin America, the Caribbean, etc. So that's one point. And then secondly, I think that as always in priorities, you see what are the opportunities in science, but also what are the neglected areas. And we mentioned already women's health, and I couldn't agree more on the definition. It's not the woman, it's more than just something around the genital area. We have to see where there are the big gaps, and there is a word that I don't like as such as neglected infectious diseases, but it's there. Women's health. I think we also we need to address some of the successes of what we all live much longer. So healthy longevity is even in countries that traditionally had high under 5 mortality and so on. People live longer. That's going to come with new, challenges. So there is, and then, there's no time to talk about climate change and so on. But it all points to the fact that we need to think multi-sectorally and multidisciplinary, much more than in the past. And okay, I have a medical background, so we tend to be a bit more just thinking of the medical side. And then the last point is that I would say, besides partnerships, is the thinking end-to-end, you know, from the basic research. And I think the time is gone also where we say, okay, we'll do the basic research in the US and in Europe and Japan and so, and you can do the applied research. No, these days are over also. So the end-to-end, and that should result in, or to say, in industrial, I mean in business type of opportunities, but also for society and for people. I always would, we need both. And then the final point is that let's not forget, if there's no trust in science, no trust in research, then we can forget everything. If people refuse to take a vaccine, the vaccines don't work. And
That's true.
so, and that is a big issue that is again becoming a global issue. And that requires also research and action. Thank you.
Thank you. Maybe I can turn to Dr. Roach, because the IRD is actually setting up an initiative that might help overcome or also align in some of these areas that we identified as challenges. So you're setting up an alliance of European research institutions on research and sustainable development, linking the efforts in different policy areas. Could you tell us what your objectives are for this, and also your hope for this new alliance?
Yeah, sure. So I'll try to be quick, but so actually it's following the Marseille Declaration in 2022 on research and international cooperation. So really the goal of this alliance, called ERASUD, for European Research Alliance for Sustainable Development, is really to push the fact that international cooperation in research and innovation with not for, but really with low and middle income countries, continue to be a real priority for the EU as a key driver actually for sustainable development. So really international collaboration on research and development, research and innovation is a key driver for sustainable development. So very quickly what we try to do, so we are during the very early days, but it's really to respond also to the need of European research actors to be also more coordinated in this area, to be more visible, and so also to be able to push this kind of approach higher in the European agenda. So it's really to engage with European institutions, commissions, Parliament, Council, and the different member states to be sure that actually the strategy that we are developing in terms of health, in terms of sustainable development with low and middle income countries are not just some kind of overhead funding, but really to be a co-design and a co-development of real research program with all the different partners. So the idea during the next years is really to try to increase the level of funding from the EU and the member states, which is dedicated to this international cooperation with low and middle income countries in research and innovation. Is also to make stronger the synergies, complementarities between the different approach and instruments also that exist within each member state at the European level, in order to have some kind of coherent approach for sustainable development. So all of these different crises are very strongly connected. So it's very important to act not on the consequences, but on the causes of this crisis. And so the key activities that we are starting to develop is really to engage all the different actors, because it is a very puzzled kind of environment. So during the next months and next years, so really to have all the different actors around the table, and so to try to publish position paper, policy brief, in order to give also different avenues, different ideas about how we can develop that at the European scale. And I do think that the European scale is a good level to develop this kind of global approach, actually.
Great. So this alliance will actually become the biggest advocate for increased funding and attention to these topics. Yes. Talking about funding, Dr. Gray, mobilizing domestic funding for health R&D has historically been a challenge for low and middle income countries. But with the new health order of the African Union, we've seen the issue come back under focus. How can international funders support increased investments from African member states?
So I think I'm going to answer this in 5 ways. So first of all, there is chronic underinvestment in Africa, and that threatens its economic transformation, and it perpetuates our dependence on the colonial model of extraction, which we don't want. You spoke about extraction, data going, viruses going to the global north. And so the first one is political will, and I think South Africa is the greatest example. So we're one of the biggest spenders of R&D on the continent. And of the GRD, we hover between 0.6 and 0.85%, which is still less than the 1.7% that comes from the global north. But the Department of Science and Innovation have recognized very, very closely that science productivity is associated with GDP growth, like we see in South Korea and India. So the biggest issue is our advocacy around the politicians. We've got to get them to commit the 2% of GDP, as the AU has said. So it has to come from domestic funding. But having said that, with the money that we do have, it's important to leverage our resources. And we've done this with public-private partnerships. And I think the mRNA platform is a very good example, where we're taking, discovery to commercialization on the African continent, in South Africa, and expanding our capability on the mRNA platform to other vaccines. So that's an important thing. We also leverage our money in bilaterals, and we've seen very successful bilaterals with the UK, with the UK MRC, with the Newton Fund, and with the NIH, to name but a few, as well as the importance of working with the private sector in Africa. We should try and unleash the potential of the private sector to drive R&D on our continent. So these things are very important. So we need to take our money and leverage it, either with philanthropy, with the private sector, or with bilateral government agreements, and this will drive the innovation further. So I think at a country level, at a regional level, we're committed to local R&D. We're committed to vaccine manufacturing, and to not only do the tech transfer of fill and finish. We want to be involved in IP, in API, and in vaccine discovery, and to use our capability in that area to really spur on the R&D capability in medical science. Thank you.
Thank you so much. Yeah, vaccine manufacturing is actually a beautiful example where this fragmentation is overcome by a Team Europe initiative, and also where efforts of DG INPA and DG RTD are aligning through the support also with member states together, the concept of Team Europe initiatives, the MAF Plus. I think it's a great example. So I'm taking...
Yeah, also, let's not forget that there's a 1.1 billion euro budget for support to manufacturing in Africa out of the Commission, I mean, of the EU. I think that's a game changer, because that will, if that works, and that must work, it will change the power relations fundamentally. If that's not there, then we will always run into the same problems. And that's, I think, where Europe is really has shown that it can have leadership without having to decide. It is already South Africa, Rwanda, Senegal. So I think that's again a positive note,
Yes, and it's great to end on a positive note, even though I'd love to continue discussing and maybe interacting with the audience, but maybe you can do so over lunch with some of the speakers, also to respect the time of our speakers. So I take away from this that we need to overcome fragmentation, maybe looking at the whole ecosystem more systemically, in collaboration, on equal footing. We need funding, which will maybe, and for that we need advocates, hopefully also many of you in the room who will join us in calling for an ambitious budget for the next Research and Innovation Framework Program, FP10, and within that, more attention to international collaboration and health research. Thank you very much, and see some of you over lunch maybe.